And I just want to start by introducing Dr. Metz. We really appreciate spending time with us today. This is a collaboration between MercyOne and Dignity Health Global Education. Dr. Metz is a pediatrician. He is a graduate of Des Moines University and University of Missouri Child Health Residency. He has been a pediatrician at MercyOne Des Moines since 1999. And he's joining us today to talk about how to help children cope with COVID-19, how to help with anxiety and mental health. We really want this to be an engaging webinar, so please feel free to leave some questions. We're going to have a great amount of time for question and answers at the end. But without further ado, I'll hand it off to Dr. Michael Metz. Thank you so much.
Thank you, Patricia. I appreciate it. I was having a tough time just staying there and being still and not talking, so I really feel better able to just kind of say some stuff. First off, if you'd have asked me 2 years ago, had I expected that I would be doing a talk on anxiety right now, I would have said no. And you'd have said why, and I had said because I didn't have 20/20 vision. Get it? 20/20 vision. Okay, so just so you know, I do tell some bad dad jokes, and we'll probably do that throughout the course of this to kind of lighten the mood a little bit. So as we talk about things, I have a disclosure to say I have no financial relationships with anybody that I'm going to talk about today, whether it's authors or books or movies or any of the applications. So these are really just for me to help you understand that there are some options out there. I have no financial relationships to disclose. And we're going to try to move this along and see how that works. So COVID-19, really, there are so many people who are having a changed life right now from COVID-19. And that's partially why we're here. We know that people are really struggling, and the level of anxiety is so much higher today than it may have been 3 months ago or 6 months ago. People have lost their jobs, children are out of school, and obviously you can see that there are a lot of bad outcomes from COVID. And we're really not looking at COVID today as a disease, but we're going to really more talk about the things that COVID has done in the realm of mental health. But as you look at the most updated numbers over here, you can see that 73,000 deaths with 2,549,000 cases. So there are a lot of people being affected, and we're right here, you know, in the United States for the most part. And so we're really having some outbreaks. Every state's a little bit different. And so where you're at, you may have different rules than we have here in Iowa. So I saw some of the early questions, which were like, can you go out and play on the playgrounds? Can you spend time with others staying 6 feet apart? I'm going to leave that mostly for the infectious disease experts, the WHO and the CDC to talk about. Instead, we're going to talk more about resilience and anxiety. So there's an author and an adolescent medicine doctor. His name is Dr. Kenneth Ginsburg, and he's written a book called Building Resilience in Children and Teens. And in that, he talks about 7 C's of resilience. So competence, confidence, connection, character, contribution, coping, and control. So just one of those 7 C's by themselves doesn't provide a child or an adult with resilience. And as we look at our 7 C's right now, we're trying to measure how our 7 C's are working against the 8th C, the 8th C right now being COVID. And how do we balance our concerns about COVID versus being able to build on the things that have provided us with resilience? So we're going to focus a little bit more on coping, and we're going to focus a little bit more on connection and confidence today than some of the others. So how has the pandemic affected our children? Well, our children are probably more anxious. We know that. There's a lot more fear. Certainly there's a lot of isolation. So kids who are used to going to school every single day no longer have that opportunity. They're at home. They might be at home with a family of 5 children, or they might be at home by themselves as an only child. Their parents may still be working or not working, and that can create a lot of isolation for them. And there's worry. There's a lot of worry. And so this pandemic has really caused a lot of issues for our kids. And now, how do I know that it's caused problems? I'm going to give you 3 examples. One, any of you on social media, if you're on Facebook right now, I know you are, that social media I've been watching. I've got friends who are parents and teachers, and they're at home. And so recently, I was just scrolling through and I saw one mother bringing up the point that her 5-year-old son just isn't the same. He's having troubles controlling his anger. And that was not the case prior to being home and having COVID related concerns. And so I was going to respond to her quickly and say, hey, I've got some ideas. And then I started scrolling through and found a lot of other parents with similar concerns, maybe even more concerns than what she was having. And I thought we should probably reach out and do something a little bit more than just put a little something on Facebook. And that's why we're kind of here today. The other reason I know is that my own son had a school assignment, and he doesn't love writing. It's not his thing, but he sat down and wrote this. And I thought it was really quite, really quite good, as he really kind of talked about what his feelings are. So as I just read this, it says, this is okay. We will be fine. We're here together. We are fine. This is really boring. I don't know if he meant his writing assignment or being at home, but I think it was the being at home. I really miss my friends. I can't be near my friends. There is less fun now, and I don't have anyone to play with. I don't know. I don't know what to say about it. I don't know what to say about it. I don't know what to say about it. Why should I be questioning it anyway? It's getting worse. It is more scary. So there's a 9-year-old's view of what's going on with our pandemic and what it's doing to him. The other reason I know is that because we've started to do a lot of telehealth visits in our clinics. I don't know if any of you have taken advantage of this, but your providers probably are now offering you the chance to do exactly what we're doing here right now, right? A Zoom visit to talk about what's going on. And I've had a lot more Zoom visits for children who are anxious or concerns of anxiety. A 13-year-old just the other day, the mom called and said, I'm worried my son is anxious and or depressed. So we got on and I talked with him by himself, and that's important, talking with him without having the parents there. And he said, I am not anxious, I'm not depressed, I just don't know what to do with myself. I don't have a routine anymore, I just don't know what to do. And so he was at a loss, and we'll talk a little bit later about some of the things I suggested for him, but he was at a loss of what to do. So in 3 different areas of my life, I have found out that anxiety is a major issue today. So what do we know about anxiety? Is it common? It is. And anywhere between 8 and 24% of Americans are diagnosed with an anxiety disorder. Most commonly, we're quoted at 10%. And how do we diagnose an anxiety disorder? Really, you have to have more than half of your week that is anxious. And then you have to have more than 6 months of duration. And we talk a lot in medicine about 2 words, absenteeism and presenteeism. Absenteeism is when children are missing things that they would otherwise want to do. So they're missing school, they're maybe missing birthday parties, they're just not comfortable going out with their friends. Their anxiety overwhelms them enough that they miss completely on doing things. Presenteeism is a little different, easier to say presenteeism. I should get working on that. But anyway, presenteeism is really more about, are you in the moment? Are you able to be there? So you might go to school, you might go to a birthday party, but you're not able to think about it. You're not able to enjoy it because you are too much into your anxiety and your worry. So when we talk about how to define it, it's about absenteeism, it's about presenteeism, it's about frequent, and it's about long. Intermittent anxiety is much more common right now. And we're seeing this over and over. Again, short period of time. We've only had the COVID concern for about 3 months. So we really can't say everyone has an anxiety disorder, but we know that it's more common. Here's something you need to know. Anxiety itself, fear itself are really normal. And so I went back and I was looking at a couple of movies on Disney, and I found this clip and I thought it really helped me put into some perspective. What is fear?
Ever wonder why you feel the way you do? We'll get to know your emotions. When the unexpected is staring you in the face, fear is there to keep you safe. With speed and wisdom, Fear assesses the situation and settles your nerves in his own special way. He's got this. Thank you, Fear. Get to know all your emotions with Disney Pixar's Inside Out, rated PG.
So I don't know if anybody remembers that movie, but I actually watched it in its entirety in the last couple of nights and really found it a very nice description of all of our emotions and how they're intertwined and how they work together. Fear is a normal emotion, and in fact, it helps us. It's not something that isn't supposed to be there. It's part of our brain. It's our alarm system. It warns us of danger. It helps us prepare for tests. It helps us prepare for athletic events. It helped me prepare for this webinar. So don't be afraid to admit you have anxiety. It's okay. You're not alone. A lot of people are having anxiety, and in some places, it's really helpful. The symptoms of anxiety can be many things, and it's hard to really define in some children, but it might be poor focus, which is otherwise often interpreted as ADHD, but it could be a sense of impending doom. You could have a child who gets more irritable, maybe someone who can't sleep well, frequent common headaches, chest pain, shortness of breath, tachycardia, meaning a fast heart rate, or abdominal pain. Frequent abdominal pain is not an uncommon presentation for us for children who are anxious. Nausea can happen, as well as vomiting. So you can get so anxious that vomiting actually occurs. So this is several of the ways, but there are more ways it can present. The triggers are many. The triggers are many. And so school in the past has been one of them, but the lack of school right now is really one of the common causes of anxiety for kids. The fear of illness, COVID, the fear of coronavirus is really taking its toll and causing a lot of anxiety. Can I go outside? It's coronavirus out there. Can I see my friends? Those things are coming up. Fear of failure is a common trigger. Noise for some people, crowds for others, and maybe water. I don't know if anybody's afraid of water here. There's kind of normal anxiety around water too, right? So you think about a 4-year-old who goes to a pond and thinks there might be some monsters in there, so doesn't want to get in the water. That's not really an abnormal anxiety. They're at that age, 3 to 6 years old, where they have a lot of magical thinking. And so that's not necessarily abnormal. What about the 13-year-old who went swimming in the ocean, snorkeling, and had a near drowning experience? Obviously, they're going to have some anxiety. The problem with water might be that your 10-year-old who doesn't want to get in the pool because they're afraid of sharks. Well, that is more irrational, and one that you want to be more concerned about than possibly the other two. What does a parent do? And that's what we're really going to talk about the rest of the time is that, yeah, so we've defined that anxiety exists. Anxiety is in greater, more common presence right now, that COVID has created more anxiety, but a parent really needs to be child focused when we're talking about how we deal with anxiety for our kids. Help your child develop some confidence that they are safe. Don't be afraid to have discussions about COVID, but you have to limit the amount somewhat. So early on, I was watching the news quite a bit, and in front of my 9-year-old, my 22-year-old, my 25-year-old, they're not as nearly anxious about it, but they were watching, we were watching, and I kind of realized I probably need to bring that back a little bit. The 9-year-old probably doesn't need to see every detail of the COVID experience. But as you get older, and the 13 and 15 and 18-year-old, you may be able to show them more than the younger kids. Help your child develop coping skills. So coping skills are really going to be important over the next few months or even the next few years. And one of the authors that I was recently reading a book of said any healthy strategy that helps a child feel good enough to persist is a coping strategy. So I'm going to present some of those today, but quite honestly, they aren't the only coping skills. Any healthy strategy that helps a child feel good enough to persist is important. Now, we want to make sure that parents have a little bit of parent-centered time too. So as we talk about taking care of yourself, that is really important. So parents, you have to take care of your own self, maybe develop some of your own coping strategies. Anybody ever fly on a plane, right? And the steward or the stewardess gets up and they start to do the safety talk. And on that safety talk, they talk about if the oxygen mask drops, what are you supposed to do? Right, you're supposed to put your oxygen on first before you help somebody else who may not be able to help themselves. Now, that may be something that is a little bit apples to oranges, which, by the way, do you know what you get if you have 5 apples in this hand and 14 oranges in this hand? You have big hands. But anyway, I'm going to keep telling some bad jokes. Don't worry, it's going to keep coming. So take care of yourself along with taking care of your child. Engage with your child. You may think that's a child-focused thing, but it really isn't. So what makes a parent feel better? Engagement with their children. We love our children. We want to see them happy. We want to see them well-adjusted. We want them to grow to be productive adults. And so it improves our life too when we're engaging with our children. And again, keep your sense of humor. Use it often. There's nothing wrong with having some fun and smiling even in stressful times. So we're going to go ahead and move on to the backbone of health. So an American Academy of Pediatrics initiative has been the 5210 program. 5210 really stands for having our kids eat 5 or more servings of fruits and vegetables a day. So to break that down, really what we're talking about is eating healthier foods. Eating foods at the right time, eating the right amount. And now's a great time to refocus on that. We're all kind of falling apart. We're snacking too much. We're not eating the right foods. We're stress eating. But let's get back to a routine where we're eating healthier foods. So 5 servings of fruits and vegetables every day is a great idea. Get away from those foods that are more processed. Get away from those that have more dyes and work on fresh fruits and vegetables. The weather's turning nice. We can even start doing some gardening. 2 hours or less of recreational screen time. That is a tough one. So in our house, we're definitely struggling with that. And so give yourself a break. We know that your kids are going to get more screen time right now. So you can go, he's not yelling at me, because we struggle with it in our own home. But do know that it's probably good to be careful on watching what your children watch, knowing your child. What are they capable of seeing? What really happens to them when they play too many video games? What video games are appropriate for them? So we want to make sure that we're looking at 2 hours or less of recreational screen time. As a general rule, don't beat yourself up over it. 1 hour or more of physical activity. So that's important. We want to make sure we're getting out there and staying active. So my son's PE teacher right now is me. He's not very happy with his PE teacher, but I still work with him. We get outside, we do some things. Even if he doesn't love it, it keeps him active. And it's a great thing to do sometimes to break up that screen time. And then we want you to reduce your sugary drinks, get more water, a little bit more low-fat milk. Those things are helpful to keep us healthy. So when we talk about the backbone of mental health and the backbone of health, this is where we're at. Sleep is also super important. The American Academy of Pediatrics has put out a nice table of what is right sleep for what age. In general, we're really focusing on the anxious child. That's your grade schoolers, your preschoolers, and your teens. We're talking somewhere between 9 and 12 hours of sleep each night. So we want to make sure we develop a routine for bed. A lot of the teenagers I've talking to have totally fallen off their routine. I asked a boy yesterday what time he was going to bed, and he said early morning. Early morning, so 2 or 3 in the morning right now, because there's no school. He's sleeping till noon, and he has no energy the rest of the day. So we want to think more about developing your bedtime routine. So bedtime routine is something that's important. You don't just watch your TV and then go to sleep. A lot of people require more. So what do I recommend? I recommend that about an hour before bed, you turn off your screens. So that'd be great. And then you also want to maybe take your bath in the evening time or your shower in the evening time. This helps us calm down. Another thing you could do if you don't like your shower in the evening is just soak your feet in warm water. Then you want to get a light snack, not a big snack, but a light snack. Get yourself to a room that is cool, but not hot, not cold, just cool, and a nice warm blanket to cuddle up into. You might put on something nice to hear. So some people like ocean sounds, or some people like the sound of rain. You might be able to do that. That might help you fall asleep better. And then the other things that are helpful are maybe reading a book before bed. We have a saying in pediatrics, brush, book, bed. So that's important too. And something nice to smell. People don't think about that, but having something nice to smell can sure make a difference in helping you fall asleep. So we want to get back to a routine to help our kids with anxiety. Eat the right foods, get the exercise, cut down on the screen time a little bit, and get your good sleep. Getting up the same time or roughly the same time every morning is important. Now, you might have been getting up at 6 o'clock in the morning for school previously. Maybe you don't have to get up that early anymore. That's okay. But set a time that you feel like it's appropriate to get up. So other things that you might do, some grounding techniques, some techniques that bring you back to yourself when you're anxious would be to use some of our apps. We have some breathing exercise apps that you might look into. So the Breathe to Relax app is one that I was informed about 4 or 5 years ago. And it really is a nice and easy app to use. You can download this for free on your phone. And really all it does is tell you to breathe. And what we've learned about breathing is that it can help you refocus if you do it right. I tell all my patients this, they're experts in breathing. They already know how to do it. But sometimes you just got to get back to basics and learn how to slow it down. So this app really just says, hey, breathe in, breathe out, breathe in, breathe out. If you like something a little bit different, the app on the other side is the breath ball. And I downloaded this recently to look at it. And the ball gets larger and the ball gets smaller and larger and smaller. And that is another way that you follow the ball. And that can help you breathe. So breathing exercises are a really easy way to help someone who's anxious kind of get back in the moment, slow down their thoughts, and be less concerned. You know, the anxiety center is your fast center. It happens quick. You want to slow yourself down so that your thinking mind can start to take over a little bit. My favorite, and unfortunately our video isn't going to work, is actually bubble blowing for breathing exercises. Really simple stuff, right? Anybody remember that when they were a kid? Blowing bubbles? It brings pure joy to most people. And so blow some bubbles with your kids. There's nothing wrong with that. That's a great idea. And it will help you slow down your breathing. If you've ever tried to blow bubbles, you can't do it when you're angry. You can't do it when you're anxious. You have to be able to, otherwise you get no bubbles. And so bubble blowing is something you can do. In fact, I even keep in my office, right there, some bubbles for my patients who get really anxious in the office, and we'll blow bubbles together over the sink, of course, whenever they're really super anxious about shots or about an exam. That's helpful for them. Other things that you might do to help with your anxiety are to learn how to meditate. We all have a little bit more free time now. Meditation might be for you. There are a couple of really good and easy to use applications that I've downloaded. Let's Meditate is one. Headspace is one I've used more. Some warnings, the Headspace app does have some pay for service as well as free service, but they have little videos that even younger kids can start to learn about how to meditate, how to kind of just slow your mind down, feel your emotions, and process them. I'm not a yoga guy. I think it hurts too much, but yoga classes are another great choice for some people. Maybe that is for you. If you have a faith, prayer is a great way to calm your anxiety. So you can talk to your clergy or your pastor about some ways to learn to pray. You can read scripture and you can recite prayers. Those are things that can be really helpful in developing a calming presence from praying. You just sit and listen quietly to see what response you get from God. So meditation, prayer, both of those can be really helpful as well. So what do you see in this picture? It's a quarter. And so sometimes in order to reduce your anxiety, you just need something physical to hold on to. And I got to be honest with you, my wife will tell you this. I've been kind of attached to quarters for a long time. I didn't even know what I was doing. But if I had a couple of quarters in my pocket, I was anxious, I would just start feeling on them. I would start moving them around. So with your children, you can do this. What do you notice about it? Is it hard? Is it soft? Is it big? Is it small? Is it shiny or is it dull? Is it smooth or where does it have texture? Because the nice thing about quarters is they do have some texture to them. And so if you get a child who's starting to become anxious, before they become out of control with this, you can get them to slow down, get in the moment, feel on an object. It doesn't have to be a quarter, but that's what I choose to use. And so another option for you as well. One thing I've learned too is that it's okay to worry. And so you can set up some worry time. You can schedule it, and it's okay. Listen to your child during this time. Set up 10 a.m. worry time every day. When the time is up, you ask your child, package up your worry. Let's put it away. Let's get to our tasks, and we can unpackage it again tomorrow, and we can kind of talk about it again. So something that you can do. Now, one thing that's really important about worry time is it's not about solving your child's problem. Instead of solving the child's problem, your job as the parent is just to listen. Listen to what they've got to say. Don't minimize their worries. Don't maximize their worries. Just sit and listen until the time is up, and then help them to package it away and get on to doing the next thing they need to do. I've been working on this one with my own family and my own self, really, is a lot of people say, I can't do that. I'm not ready. And so teach your children the word yet. Dr. Ginsburg uses this in his book, and teach your children the word yet. So knowing that just because you can't do it now doesn't mean you won't be able to accomplish it later. You don't have control of your anxiety yet, but we can get there. It's a really, really nice thing to teach your kids. Use the word yet. So this doesn't always work. I've given you 4, 5, 6 different opportunities to try to work on anxiety, prevention, and care. I want to point out that any of the things we've talked about don't work very well if you do it for the first time in the moment where somebody's having some panic. Instead, you want to pick 1 or 2 or 3 of these out and start practicing them at times where things are calm and you're not worried. Have your child do some blowing of bubbles now, and actually you may be able to teach them how to blow bubbles when they're calm, and then use that even without the bubbles down the road when they start to get upset. So practice makes better. Keep practicing. So if you're not having success, what do you do next? Well, the next thing is really to get some help from your primary care provider. We're here for you. Again, now we can do it by Zoom visits, by telehealth, and you don't necessarily have to come into the office if you're anxious about coming into the office. So don't be afraid to reach out to us. Many of us have explored the idea of anxiety and how it can be treated with different techniques. Doesn't always mean medication. You might explore the idea of seeing a licensed therapist. And there's several different ways that one can get therapy. So I don't know if you've heard of play therapy, but play therapy is often used for younger children. Play therapy is not something I'm an expert on, but in reading about it and seeing some patients who've experienced it, really is an interesting thing. And parents come back to me a lot of times and say, I don't think they're doing anything with my kids. But the reality is they're structuring some play in a way that the kids can learn their emotions and kind of work on some positive behavior. It's one of those where they don't actually interfere or don't do much in the way of redirection, because that's not what play therapy is. A second option might be cognitive behavioral therapy, and CBT. You might have heard of that. Cognitive behavioral therapy works a little quicker. That's one of the advantages of it. Instead of long 24, 26 visits over weeks, you may need only 6 or 8 visits. So it's more focused on the present, the here and the now, not necessarily on your history, not necessarily on finding out why you're anxious from a year ago or 2 years ago, but how do we kind of refocus? How do we work on our anxiety level, work through our feelings? Sometimes it's negative feelings and sometimes it's hard, but cognitive behavioral therapy is a little quicker, and it is something that doesn't focus on the past. Then you all know about your traditional psychotherapy, which usually explores things at a deeper level. And our younger kids don't usually do well with that. Your adolescents might, and they might have a really good experience with psychotherapy, but a lot of them are much better off with the cognitive behavioral therapy. If you've exhausted your therapy sessions, you've done everything you can, we do have medications that we can use for anxiety. So there are multiple medications that we use, all the way down to 5 or 6 if we have to, not the first line by any means, but things that we can do. So there are some medications. Don't give up. If you need something, we can certainly help. So that's the end of the brief talk. I wanted to leave time for questions and answers. Just a quick summary. Your emotions, you have a lot of them. They're all healthy. Don't be afraid to go watch that movie Inside Out. Really enjoyed it. Parents, hug your kids. Your relationships can't be replaced. It's super important to have you engage with your children and take care of yourself. When things aren't going well, don't be afraid to do more research. Maybe you're going to read this book. By the way, I've read it, and I have a tough time getting through it all because I kind of get stopped and I start thinking a lot about it. But it's a really, really good book. If you want to get into some real depth, the Building Resilience book is really fantastic. Therapy, don't be afraid of it. If you need therapy, if it's something that will benefit your child or yourself, go ahead and just do that, because that can be useful. And don't forget to get outside. Make some use of the outdoor nice spring weather where you are. Being in nature can really help as well. So I am open now to some questions and see if anybody has anything. I can start with Patricia. I think is going to help me figure out which questions we're going to go with first.
Yes, definitely. Feel free to use the chat section. We want to make this as engaging as possible to elicit some questions, but we also have some questions that were submitted in advance. So maybe we can get started on those while people type out their questions for the next ones. So one of the questions we had was, for younger parents here, what would you say the age is that children might start to feel and understand anxiety?
So it is interesting that we know that kids do have anxiety as early as 9 to 12 months. And that anxiety is often separation anxiety, where they cling to their parents and don't want them to leave. Stranger anxiety develops about that time too. Hey, you don't look like mom and dad. I'm not going to you. So anxiety itself is rooted in even the first year of life. However, an understanding of being anxious usually is something that is more the 3 to 5 to 6-year-old. They start to understand more about being worried and being able to sort of say that out loud to their parents. Hey, I'm concerned, I'm worried. So it's early, but being able to verbalize it and understand it themselves is more around that school age.
Thank you so much for that. And then we have a question here for somebody who works in a daycare. What advice can I give to parents to distract themselves or not get anxious so they don't end up projecting their own anxiety? So I guess it's a question of how to help parents not project their own anxiety in their families and with their children.
Yeah, so kind of just a summary of what we talked about in a lot of ways is, as parents, you want to make sure that they're taking time for themselves, developing their relationships and eating right, getting exercise. Maybe they shouldn't watch the news every single day. I've got some friends, and I'm one of them, but I feel like I have to. I'm in the medical profession, that watch every single President Trump press conference. They watch every single governor conference, and they're overwhelmed with this. Hey, take a break as parents. You don't have to know what's going on every single day. Realize you are safe in your home with your kids. You may be blessed that you've still got a job. Focus on the positives in life and do some deep breathing. That could help.
Great, thank you. There's a question here in the chat. My child has started this week answering the question of what you would like to eat with I don't care, even if it's 2 choices. Could this be a sign of depression or maybe just boredom of eating at home for every meal every day now?
Yeah, it certainly could be. So getting your kids to eat is a difficult task, and we struggle with this at our place a little bit too. So I have some things that I've done. So Tuesday seems to be bring that one new food out. And when they do that, the child agrees that it's going to be something they will eat. And then what they'll notice is that if the child doesn't like it, the kid gets the ability to say, nope, don't like it, I don't want it anymore. On the other hand, if they do like it, they get to eat more and they may have learned a new food. Do keep offering a couple of foods instead of what do you want? Because when you say what do you want, you really do lose most of the time.
Thank you. There was a bit of a delay there in the answering. I hope most people got the first part of that sentence. There was another question here from Raul who says, as a healthcare worker myself, is it necessary to wear a mask at home? What would be your advice around this? Because there's a lot of anxiety at home surrounding being in the front lines.
Sure. So what I recommend is that come in the door, change your clothes, maybe shower depending on what your level of interaction with patients is. Put your clothes away in a spot that you can then maybe wash them yourself. But no, you don't have to wear a mask at home. If you're not symptomatic, there's not any reason to do that. But I would encourage people to, at the door, change their clothes, get cleaned up before they go on to do the things they would normally do for the evening. I've got a question here. I got this one.
Please.
Yeah. So it says, what did one bean say to the other bean?
What?
How have you been?
Thank you for this. And thanks for also reminding us that humor is really, really important in this as well. And reminding us that it's okay to laugh. I had another question here though. What is normal boredom and how that might be different from normal worrying, and where does anxiety maybe start for kids? When should I start worrying?
Right. So that kind of goes back to my presenteeism, absenteeism thing. So if your child is bored, try to develop your routine, try to challenge them to learn a new skill or a new thing to do right now. So boredom is normal. We see that doing the same thing every day. So you maybe try to challenge something new. When it becomes more of an anxiety, that you can see that in maybe withdrawal and maybe from, again, irritability and not wanting to be a part of things. So the presenteeism and the absenteeism. So if they're being absent from dinners, they won't come down to dinner. That's probably not just boredom. That may be something more. If you're talking with them on end and they don't have a screen in front of them, because if they have a screen in front of them, they never answer. But if you are talking to your kids and they just don't seem to be there with you, might be another sign that it's not just boredom, but it's anxiety or depression.
Thank you for that. That's really helpful. Here is one other question that was submitted by Sebastian. What is the best way to describe that COVID can kill people? So maybe how to deal with talking about death and anxiety, especially for children of different ages. How can I explain to my kids that even though their grandparents are at a risk group, they're not at an imminent risk to die at the moment?
So the best way is probably to focus on life instead of on death. And so what I tend to focus on is that, hey, you know what, grandma and grandpa, they're in their home, they're isolated from that virus. And so you don't really have to worry about death for them. You can know that they have life and they're living a good life together. And then you maybe get on a device where you can see them and talk to them. So for the younger kids, just being able to see grandma and grandpa and know that they're still there and they're still talking and they can still joke with you, those things can be helpful. As you get older, obviously the 13, 14, 15, 16-year-old, they can understand numbers and they can understand that the death rate, the case fatality rate is somewhere around 1% to 3%, probably a little bit higher than what it really is, but that's what we know now. And that the actual death rate may be as low as 0.1, 0.2%, which is more than flu, but not a lot. The problem is we don't have a vaccine for this virus right now, whereas with influenza, we don't shut down because we've got a way to protect, and we don't at this point. So as you get older, numbers can be useful. As you're younger, just show the life, show the positives, and that can really help as opposed to talking about the death part. Now, obviously, if you have a family member who has died from COVID, that's a spot where you want to make sure you get some therapy. That's not just something you want to tackle alone at home. Grief therapy really important, and there are options for that as well.
Thank you. And you touched really well on different things you can highlight for younger kids. And we actually have a question here also for teenagers. So teenagers might have a different perspective on all of this, and some of them may not be taking it as seriously because they don't consider themselves part of a high-risk group. How can you might better cope with that without touching on death, but focusing on life?
Right. So I think that one of the things is to talk about community, right? And so when I do things, I affect my community. I'm not just doing things for me, but because I care about others, I have to do some things like staying home, not hanging out with my friends. But that's not really about me, but it's about community. So this is one of those things that the resiliency piece talks about, and from Dr. Ginsburg, is that you want to start from the beginning, working with your kids towards developing an idea that they want to help others. And that part of our goal as humans is to be helpful to others. And so instead of just focusing on the, hey, I don't want to do this, talk about your community. How can you help community? And there's a great story of a group here in Des Moines area, some teenagers out in one of the suburbs who has gone out of their way to go deliver food to those who can't get out of the house. So they're caring about their community in a really active way. And it's beautiful and wonderful to watch some teenagers get credit, because, you know, teenagers are good. They usually get a very bad reputation, but teenagers can be awesome. And that's something you could do.
Amazing. Thank you so much, and really appreciate your expertise in this area. There's one interesting question here that says, how might I be able to support my friends and their kids remotely? Or for those who might not be necessarily in proximity to their kids, what is some advice you might have around supporting their anxiety remotely?
Oh, that is a good one. So again, we've got some ability to get on screens, but how about writing a little handwritten note saying, thinking of you, love you, miss you, memories that are positive memories, write those down. That's one great way to do that. Some people are driving by their friends' houses and just waving and just showing their face and waving, but not getting too close. That's another way to sort of show that that you really care about people.
Perfect. Thank you so much. I think we've gone through most of the questions. If there's anyone else in the chat who has any questions, we can't thank you enough for your time, Dr. Metz, and your expertise, and really your lightheartedness and humor in all of this, because it's something very much welcome at a time like this.
I would love to just summarize one more thing that I've been thinking about quite a bit over the last few days as I'm preparing for this. One of them is this, that in our country, we've had a lot of times that are bad. I haven't been around long enough to see all of them, but I've experienced some. And each of us know that when we have a bad situation in our country, that there's opportunity that comes with that. So although I'm not very thrilled about the state of affairs we have, I do know this, that I have hope, and that I know that somebody's going to be an innovator out there. Somebody's going to be creative and persistent and resilient, and they're going to create the better way to do something, the easier way to do something, the safer way to do something. And so we want to keep that hope and not lose it. And as somebody who is working every day and seeing my family and talking to my friends, what I want to do is build up my friends, do my best to help them, because you never know, they might be the new innovator. They might be the one that then looks back and says, hey, you know who inspired me? It was my doctor. It was my friend. It was my uncle. So I have a lot of hope coming out of this, that things are going to be really positive down the road, and that although we're not in a great spot, lift each other up. That's an important part of what we do for each other.
What an amazing message. Thank you again. And thanks to everyone who made time to spend with us today. Thanks to Dr. Metz and everyone behind organizing this. We will have a recording for those who've been asking, and we'll be able to make that available for you to share and to share these resources as well. And again, we can stay around for a little bit for more questions, but this will be the end of our webinar, and we thank you all.